She walked 3 miles every morning. She took her medications without fail. She had given up red meat, switched to olive oil, cut her salt down to almost nothing. By every measure her daughter could think of, Margaret was doing everything right. She was 68 years old, and she was doing everything right. And then one Tuesday morning, halfway through her walk, the world tilted sideways. Not pain, not the dramatic clutching chest moment people talk about. Just a strange heaviness in her jaw, a warmth spreading up her left arm, and then the ground coming up to meet her on a quiet street where no one found her for 11 minutes. Margaret survived, but the conversation I had with her daughter in that waiting room, and I have had versions of that conversation more times than I want to count, never leaves you. Because her daughter did not ask what went wrong. She did not ask about the ambulance or the procedure or the prognosis. She asked, but she was doing everything she was supposed to do. How does this happen? That question is exactly why I make these videos. Because what nobody told Margaret, what nobody took the time to sit down and explain, is that healthy habits can become dangerous habits after 60. That the same actions which protect your cardiovascular system at 40 can turn quietly against it 2 decades later. That the body changes in specific, documented ways that your doctor does not always have the time to explain in a 15-minute appointment. I am going to explain it today, all of it, starting right now. My name is Dr. James Calloway. I am a cardiothoracic surgeon. I have been operating for 29 years. I have opened over 2,000 chests. I have held beating hearts in my hands. And I can tell you from that operating table that the damage I see most often is not caused by people who gave up. It is caused by people who were trying. People who walked every morning. People who watched what they ate. People who believed they were safe because they were doing the right things. That belief, that comfortable, well-intentioned belief, is what I need to challenge today. Because the research has changed. Our understanding of what happens to the cardiovascular system after 60 has changed in ways that most primary care physicians simply do not have time to communicate. The recommendations that were handed down to you 10 years ago were not wrong for who you were then. But you are not who you were then. Your body has changed underneath you, quietly and thoroughly, and the strategy needs to change with it. Here is the physiological reality I need you to understand before we go into the 5 habits. Think of your arteries the way you think of a garden hose that has been outside for 25 years. A brand new hose is flexible. It expands under pressure, absorbs the force of the water, and releases it smoothly. An old hose has stiffened. The same water pressure that the new hose handled effortlessly now works against rigid walls. The pressure builds differently. The force distributes differently. The whole system behaves differently under stress. That is your arterial system after 60. The smooth muscle in your vessel walls has changed. The elastin fibers that gave your arteries their youthful flexibility have been replaced slowly and silently by stiffer collagen. Your baroreceptors, the pressure sensors embedded in your arteries that regulate blood pressure moment to moment, have become less sensitive and slower to respond. Your kidney function, which plays a massive role in blood pressure regulation, has typically declined by 30 to 40% from its peak capacity. This is not disease. This is normal aging. But it means that habits which were cardiovascular neutral at 40 can become blood pressure elevating at 65. And that distinction is what most people are never told. More than 60% of adults over 65 have blood pressure that is not adequately controlled, even among those who consider themselves health conscious and who are following standard recommendations. The habits we are about to cover today are a significant reason why. Stay with me, because the first one is going to surprise you. Number 1, your morning exercise routine. I know, I can already hear the skepticism. Exercise is good. Exercise is always good, and you are not wrong. Regular physical activity is one of the most powerful cardiovascular protections available to any human being at any age. That part has not changed, and it never will. Here is what nobody tells you. The timing and the intensity of exercise after 60 can work against your cardiovascular system in ways that earlier life exercise never did. Specifically, high-intensity exercise in the early morning hours is one of the most consistent triggers for elevated blood pressure events in people over 65. Here is the mechanism. Between approximately 6 and 10 in the morning, your body undergoes a natural physiological event called the morning surge. Cortisol rises sharply. Adrenaline rises. Blood pressure climbs, sometimes by 25 to 30 millimeters of mercury above your overnight baseline. This is entirely normal. This is your body preparing you to be awake and functional. In a younger body with flexible arteries and fast-responding baroreceptors, this surge is absorbed and regulated without incident. In your body now, with that stiffer garden hose, the same surge hits rigid walls and the pressure spikes harder and holds longer before correcting. Add vigorous exercise on top of a morning surge, and you have stacked 2 simultaneous blood pressure elevating events. Margaret walked 3 miles every morning starting at 7. Fast, because she had been told that brisk walking was better for cardiovascular fitness than slow walking. She was correct. But no one told her that brisk walking into a morning surge on an arterial system that responds more slowly than it did at 45 creates a compounding pressure event that her vessels were simply not managing as well as she believed. Have you ever checked your blood pressure immediately before and immediately after your morning exercise? Most people never have. Write that down. It is one of the most informative things you can do this week. The fix is straightforward. Move higher intensity exercise to late morning, 10 or 11 a.m. or to late afternoon when the morning surge has fully settled and your blood pressure is at its natural daily low. If mornings are non-negotiable for you, switch to genuinely gentle movement in those early hours. A slow 20-minute walk, light stretching, unhurried cycling. Save the brisk effort for later in the day. The exercise is not the enemy here. The timing was working against you. Starting tonight, plan your exercise schedule differently. Not next week, tonight. Number 2, your low-sodium diet. This one is almost painful to explain because of how faithfully most people over 60 have followed this recommendation. The low-sodium guidance has been drilled into every health-conscious person for 3 decades. You believed it. You acted on it. You gave up the foods you loved, stopped reaching for the salt shaker, and felt virtuous about your discipline. For many people, in many situations, it was absolutely the right call. But here is what nobody tells you. For a significant subset of people over 60, particularly those taking common blood pressure medications, including diuretics, ACE inhibitors, and certain beta blockers, severe dietary sodium restriction can trigger a physiological response that paradoxically elevates blood pressure. And you would have absolutely no idea it was happening. The mechanism involves your renin-angiotensin-aldosterone system, the hormonal chain your body uses to regulate both sodium and blood pressure simultaneously. When you reduce sodium dramatically, that system activates in compensation. It releases more aldosterone, which instructs your kidneys to retain sodium and to retain water alongside it. Blood volume increases and blood pressure rises. In a younger body with rapid kidney function and fast hormonal feedback, this loop self-corrects within hours. In the aging body with reduced kidney reserve, the correction is slower and less complete. The loop runs higher and longer than it should. There is also a second mechanism. Extreme sodium restriction, particularly when combined with diuretic medications, steadily depletes magnesium. Magnesium is one of the most critical natural relaxants of smooth muscle in the arterial wall. When your magnesium drops, your artery walls contract more and relax less fully between heartbeats. Blood pressure creeps upward, slowly, over months and years, and you never connect it to your virtuous low-sodium discipline. Does any of this sound familiar? Has your blood pressure remained stubbornly elevated despite following every recommendation? This may be why. The question to ask your doctor, and write this down, given my current medications, is my sodium intake too low for my specific physiology? And have you checked my serum magnesium levels recently? That question will immediately tell you whether your physician is actively tracking this interaction. Most will be grateful you asked. We are halfway through. 2 more habits after this one. And number 4, that is the one I want you to stay for, because it involves something that essentially every health-conscious person over 60 is either taking or has been advised to take. I had a significant blind spot about it for the first 12 years of my career. Stay with me. Number 3, your fish oil supplements, omega-3 fatty acids. You read the research. You started taking fish oil every morning because EPA and DHA reduce inflammation, protect the arterial wall, and lower triglycerides. All of that is true. None of it is wrong. Here is what nobody tells you. The form, the dose, and the storage of omega-3 supplementation matter enormously after 60. And most people are getting at least one of those 3 things wrong in ways that eliminate the cardiovascular benefit entirely, or in some cases, actively reverse it. Fish oil is a polyunsaturated fat. Polyunsaturated fats oxidize. When capsules are stored in warm environments, kept past their expiration date, or consumed in doses higher than your body can efficiently process, the oxidized lipid byproducts are not neutral. They are inflammatory. They specifically increase oxidized LDL, the fraction of LDL cholesterol most directly associated with arterial plaque formation. And unlike the standard cholesterol markers your doctor checks at your annual physical, oxidized LDL is rarely measured unless you specifically request it. There is also the dose problem. The cardiovascular benefits of omega-3 supplementation have been most consistently demonstrated at EPA plus DHA doses of 2 to 3 grams per day. Most over-the-counter fish oil capsules contain between 300 and 500 milligrams of combined EPA and DHA per capsule. If you are taking 1 capsule daily, As the label suggests, you are receiving 1/6 to 1/10 of the therapeutic dose. You are paying for a benefit you are not receiving, while potentially introducing low-level oxidative stress to your arterial walls. The fix. Use a triglyceride form omega-3 product at 2 to 3 grams of combined EPA plus DHA daily. Store it in the refrigerator and consume before the expiration date. Or stop supplementing entirely and focus instead on 2 to 3 servings of fatty fish per week, where omega-3 is delivered in its natural matrix alongside cofactors that protect against oxidation. Either approach is valid. Give it 90 days and ask your doctor to check your oxidized LDL alongside your standard lipid panel. Number 4, your calcium supplements. I said I would come back to this one, and I want to be precise, because this topic gets misrepresented in both directions, either dismissed entirely or used to frighten people who genuinely need calcium support. Calcium absorbed from food, dairy, leafy greens, fortified products, arrives in your system slowly in manageable amounts, alongside natural cofactors including vitamin K2 that direct calcium efficiently into your bones and teeth where it belongs. Calcium from a supplement arrives as a concentrated bolus. Your intestine absorbs it rapidly. Your blood calcium level spikes transiently. And in the minutes following that spike, a specific thing happens in your cardiovascular system. Calcium is the primary trigger for smooth muscle contraction in the arterial wall. This is, in fact, the precise mechanism that calcium channel blocker medications are designed to interrupt. They block calcium-mediated contraction of those same arterial walls. When you take a calcium carbonate supplement and create a transient blood calcium spike, you are, for that window, doing the physiological opposite of what a calcium channel blocker does. Your arterial walls contract more strongly. Blood pressure rises. In your system now, with slower baroreceptor correction, that effect persists longer than it would have at 45. Multiple large studies, including the Women's Health Initiative and several subsequent reanalyses, have found associations between calcium supplement use without adequate vitamin K2 and increased cardiovascular calcification, calcium depositing in arterial walls, rather than being directed to bone. Arterial calcification is one of the most direct structural contributors to arterial stiffness and elevated systolic blood pressure. I am not telling you to stop taking calcium without talking to your physician first. There are people for whom the skeletal benefit genuinely outweighs the cardiovascular concern, and that individual conversation matters. But the question to ask, and write this down, am I taking vitamin K2 alongside my calcium, and is this combination appropriate given my cardiovascular history? The research on this pairing is not obscure. It simply does not always make it into the 15-minute appointment. It is never too late to have that conversation. Number 5, your stress management practice. You meditate. You do yoga. You took the advice about managing stress seriously, and you built a consistent practice. I am not going to take that away from you. The evidence supporting meditation and mind-body practices for cardiovascular health is real and substantial. Here is what nobody tells you. Certain techniques within stress management, specifically those involving breath holding, extended breath retention, or the deliberate recall of intensely stressful memories for therapeutic processing, can create acute blood pressure surges in people over 60 that are more significant than the chronic stress those practices were designed to address. The mechanism involves something called the Valsalva response. When you hold your breath with your glottis closed, as happens naturally during certain yoga postures, certain meditation techniques involving breath suspension, and during the effort of getting up from the floor, you increase intrathoracic pressure sharply. Blood return to the heart drops. Your peripheral blood vessels contract to compensate. Blood pressure spikes. When you release the breath, a sudden flood of blood returns to the heart and pressure spikes again in the opposite direction. After 60, with a stiffer arterial system and a heart less equipped for rapid volume swings, these pressure oscillations are more pronounced and slower to correct. There is also a second mechanism in practices that use vivid recall of stressful experiences. The acute cortisol and adrenaline release triggered by intense stress visualization can elevate blood pressure by 30 to 50 millimeters of mercury within minutes. These acute spikes, repeated in the context of a daily practice, accumulate across weeks and months in ways that matter. I am not asking you to stop. I am asking you to modify. Avoid breath-holding techniques if your resting systolic is above 140. Choose stress processing modalities. Somatic therapy. Progressive muscle relaxation. Gentle guided visualization. That do not require high sympathetic nervous system activation. And check your blood pressure before and after your practice periodically. What you find may genuinely surprise you. I want to be honest with you for a moment, not as someone making a video. As a surgeon, I have stood at an operating table at 3 in the morning holding a heart that had been quietly failing for years. failing not because the person was careless, but because they were careful in every way they had been taught to be careful in a different decade, in a different body. I have spoken to families in waiting rooms at 5 in the morning, families who kissed someone goodnight 8 hours earlier with no idea they were saying goodbye. In case after case, the contributing factors were not mysterious. They were not rare. They were not some exotic combination of genetic misfortune and bad luck. They were fish oil taken in the wrong dose for years. Calcium supplements without K2, slowly hardening what should have remained elastic. Morning workouts timed directly into a blood pressure surge that nobody had ever thought to map. These are not exotic risk factors. They are the background noise of millions of ordinary mornings, kitchens where well-intentioned people do the right things, the things they were told were right, without knowing those right things had quietly shifted beneath them. That background noise, accumulated morning after morning, year after year, builds into the kind of structural damage that shows up on my operating table. And it does not have to. I want to tell you about a patient. I will call her Patricia, 71 years old, recently retired, and by her own description, militantly healthy. She exercised daily. She had followed a low-sodium diet for 11 years. She took 7 supplements every morning, including calcium, fish oil, and a multivitamin. She maintained a daily meditation practice. Her primary care physician had told her, at her last physical, that her blood pressure, consistently around 152/90, was managed as well as could be expected for her age. She came to me after a minor cardiac event, not a full heart attack, but significant enough to prompt a cardiology referral. We went through her entire morning routine together, supplement by supplement, habit by habit, timing by timing. We identified 3 of the 5 patterns I described today, operating simultaneously in her daily life. We moved her exercise to 10:30 in the morning. We adjusted her calcium supplement and added K2 with her physician's oversight. We switched her fish oil to a triglyceride form product at a therapeutic dose. We adjusted her sodium intake slightly upward with her cardiologist's input and rechecked her magnesium levels. 8 months later, her blood pressure was 136/82. She had reduced from 3 blood pressure medications to 1. She was hiking with her grandchildren for the first time in 4 years. The first thing she said to me was, "Why did it take until I ended up in your office for someone to finally sit down and tell me any of this?" That question has stayed with me every single day. It is a big part of why I make videos like this one. Let us bring it together. 5 healthy habits that may be quietly working against your blood pressure after 60. Number 1, morning exercise. The habit is entirely right, the hour is not. Move intensity away from the morning surge. Number 2, extreme sodium restriction on diuretic medications can activate the renin-angiotensin system and deplete magnesium, raising the very pressure it was meant to lower. Number 3, fish oil at subtherapeutic doses in poor storage conditions may deliver oxidative stress rather than cardiovascular protection. Dose and form matter enormously. Number 4, calcium supplements without vitamin K2 may contribute to arterial calcification and elevated systolic blood pressure. Ask your physician about this combination specifically. Number 5, breath holding and high arousal stress processing create acute pressure surges that accumulate. Modify the method, not the intention. Which of these 5 habits do you recognize in your own daily routine? Tell me in the comments below. I read every single one. You may find that others share your exact situation, and that conversation matters. There is someone in your life right now, a spouse, a sibling, a close friend, who is walking every morning and taking their calcium and doing their very best. Send this to them. Not because something is wrong, because this is the information they deserve to have before something goes wrong. That one share might be the most important thing you do today. Every week I bring you honest, evidence-based information that I wish every one of my patients had access to long before they needed surgery. Information that should have been in every appointment but never made it into the 15-minute window. If that matters to you, subscribe. One last thing, and I want to say this personally. Everything I have shared today is grounded in published cardiovascular research and in 29 years of clinical experience as a cardiothoracic surgeon. But your situation is individual. Your history, your medications, your specific physiology, these are yours alone. Before changing anything, any supplement, any timing, any dietary approach, please bring these questions to your own physician first. That conversation is not a formality. It is the whole point. Better information leads to better conversations. Better conversations lead to better outcomes. That is the only chain that has ever mattered. Your heart has been working for you every single minute of every single day for 60, 70, 80 long years without ever asking for a single thing in return. Give it this.